Perfect. And Everybody, welcome to tonight's live telephone town hall with Congresswoman Rosa DeLauro, your representative for the 3rd District of Connecticut. My name's Chris. I'll be moderating the conversation tonight. In just a few moments, we'll be joined by the Congresswoman, but before we begin, I'd like to explain what will happen in the next hour. The purpose of this call is to provide an update on health care coverage ahead of Medicare and ACA open enrollment. We'll be joined by Judy Stein of the Center for Medicare Advocacy and Susan Rich-By from Access Health Connecticut. We'll also be asking some poll questions this evening so that we can hear from everyone in the audience. If you are on the phone, you can vote on the poll by pressing the corresponding number on your telephone keypad. If you're online, you can vote by selecting your response below the streaming player. If at any point during tonight's call you would like to ask Congresswoman DeLauro a question, simply press *3 on your telephone keypad. Again, that's *3 if you'd like to ask a question live. You will continue to hear the town hall until one of the Congressman's staff members can assist you. To join Congresswoman DeLauro's e-newsletter, press *6 to provide your email address to our team. If you're streaming the event on our website, you can simply type your name and question below the streaming player. If you don't have a chance to ask your question during tonight's call, please note you'll be able to leave a voicemail for the Congresswoman and her staff at the end of the call simply by remaining on the line. And with that, please welcome Congresswoman DeLauro.
Good evening, everyone, and thank you so much for joining tonight's call. This is Rosa DeLauro, representing Connecticut's 3rd Congressional District. If you would like to ask a question tonight, again, please press *3 at any time. This places you in a queue to speak to a member of my staff. Tonight, I am here to listen to your questions about President Trump's cuts to health care and how they will affect the premiums you pay for insurance plans through Access Health Connecticut. Medicare open enrollment starts next week, so we're also here to answer any questions you might have about the differences between traditional Medicare and Medicare Advantage. Before we get started, let me just say a few words and then introduce our guests who will be helping to answer your questions tonight. Americans are in a cost of living crisis. People today live paycheck to paycheck. They are trying to cope with the high costs of housing, with groceries, electricity. And quite frankly, this cost of living crisis, the health care costs are at the top of that list that are so burdensome for families who do live, as I said, paycheck to paycheck. President Trump is making it worse. He and his Republican allies in the Congress are allowing the Affordable Care Act, the insurance premium subsidies, to expire. Those subsidies have helped millions of Americans who purchase health plans from state health care exchanges like Access Health Connecticut, and that includes 142,000 Connecticut residents who are being affected. And thanks to President Trump's health care tax hike, premiums could rise dramatically. And this is a health care crisis that has really been engineered by President Trump. A family of 4 with a household income of $130,000 could end up paying nearly $13,000 more for premiums. A family of 3 making $109,000 could see an $11,000 increase. And an older couple with an income of $85,000 could see their premiums increase by nearly $30,000 a year. I don't think I have to say to anybody out there, how do people afford to do this? And without these premium subsidies, people are on their own. It really is outrageous that this is where we are today. Senate and House Republicans You know, the issue will come up, and you may have questions about this, about a government shutdown. But what is at the center of this government shutdown is this issue of this health care crisis. And the Senate and House Republicans have shut down the government rather than to address this problem. They refuse to sit down with Democrats to fashion a bipartisan compromise of going forward. They created this crisis with their big, what they call their big, beautiful bill. And Democratic leaders are fighting to extend the insurance premium subsidies, and we're trying to do that before December 15th. Why am I saying December 15th? We anticipate that in Connecticut, the notices are going to go out about premium increases, around the 20th of October. November 1st through beginning of December is the open enrollment period. You have to pay your premium by December 15th if you want to be covered by January 1st, 2026. So it is now we need to have this discussion. As Speaker Johnson said, let's kick this discussion to December. You can't do that. People are making their decisions right now. What my colleagues on the other side of the aisle are saying that this is going to cost us $1.5 trillion. They had no problem providing $4.5 trillion in tax cuts. That was in the big, beautiful bill. $4.5 trillion in tax cuts to billionaires and the biggest corporations. And at that time, they said, let's make these permanent. Let's make these tax cuts permanent. And they claimed that it was going to be free. That was no cost involved because we were extending current policy. They refused to make the premium subsidies permanent, and they say there's a $1.5 trillion needs to get paid for that. The big, beautiful bill also triggers a $500 billion cut to Medicare. So what aspects of Medicare specifically could be on the chopping block? Well, it could be almost anything. The federal government may have to reduce payments to hospitals, physicians, to other providers, which could lead to providers offering fewer services or simply no longer accepting Medicare coverage. You could see higher out-of-pocket costs for medical services and prescriptions, especially since President Trump included a loophole in the bill that weakens Medicare's ability to negotiate drug prices. Effectively, it gives away $5 billion to Big Pharma. And for Medicare Advantage enrollees, benefits like dental, vision, or hearing coverage could be scaled back or even eliminated. The priorities could not be clearer, which is why myself, the Democratic leadership, we are demanding that they come to the table now. Let's negotiate reopening the federal government. Let's lower the costs for health care. Let's cancel the cuts that they have made through their legislation. And what we need to do is to save health care for the American people. I'll give you my word on this. I'm not going to stop fighting for affordable health care for you and for your families. Let me introduce my guest for the evening. I am grateful to be joined by Susan Rich-Bai. She's Director of Legal and Governmental Affairs for Access Health Connecticut. Susan has been helping sound the alarm on President Trump's health care crisis and can tell you more about how Access Health is approaching this enrollment season. I'm also joined by Judy Stein, founder of the Center for a Medicare Advocacy, which is located right here in Connecticut. Judy is unbelievable and an unbelievable champion for Medicare. And the Center for Medicare Advocacy has become a crucial source of information and legal services in healthcare policy. So I want to say thank you both for joining me today. What I want to do is let's move to our questions, and people need to press *3 to ask a question. The team will connect you, and we will engage with Susan and with Judy to talk about their work and answer your questions as well. So let's go to the questions.
Thank you, Congresswoman. I'd like to echo that. Again, please press *3 on your telephone keypad if you would like to ask a question live. Our first question, Congresswoman, is an online question from Sean. Sean asks, will QMB be affected by Medicaid cuts?
These are the dual eligibles. That's what that is about. I will make that, and then I'll kick it to my colleagues, for them to add to it. We provide financial assistance from Medicaid to help dual eligibles with Medicare costs. So you could be eligible for Medicare and Medicaid, and that means that what we do is to provide the wherewithal for the financial assistance to deal with that. There are individuals, as I said, who qualify for Medicare and Medicaid. When an individual's income and assets are low enough to qualify for Medicaid assistance and Medicare costs or for full Medicaid benefits. What is done is the bill that they passed rolls back the rules that make Medicaid more efficient, saves the state money, enhances program integrity, and these rules were finalized and include a bunch of policies to cut red tape, get rid of outdated requirements, and what we needed to do. This will have a definite effect on what happens to those who are. What is being proposed will have a definite effect on those who are what are called dual eligibles, who qualify for both Medicaid and for Medicare. I'm going to leave it there because I've got two experts on the phone who can illuminate us more on this issue. Judy, and then Sue.
Yes. Thank you so much, Congresswoman, and thank you, Sean, for the question. QMB is the Qualified Medicare Beneficiary Program. It's part of what's known as the Medicare Savings Program. There are three components. QMB, they've all got initials, but there are three components, but we'll speak just generally. It's Medicare Savings Programs, and the QMB, Qualified Medicare Beneficiary component, will allow people who are not quite low income enough to qualify for full Medicaid, it's called, which the Congresswoman was speaking about. Dual eligibles are generally considered those who have low enough income to qualify for full Medicaid, sometimes called Husky in Connecticut. The QMB is a component of the Medicare Savings Program, and this allows people who are low income but above full Medicaid income levels to get assistance with their Part B premiums and co-payments. This is very important because the Part B premium, as you know, is about $200 a month, expected to be about $206, I believe, for 2026. So it's about $2,500 a year that can be saved for people and be back in their ability to use for other needs if they qualify for the QMB component of the Medicare Savings Program. People who qualify at the moment have an income of up to $3,209 individuals, and a couple $4,336 per month. And those income limits are in effect until March 1st of this year. So in Connecticut, we're very fortunate because our legislature decided a number of years ago and has reiterated this over the years that there is not an asset test in Connecticut. They won't look only at income, not whether you own a home or a car. no asset counting, just income, and it's $3,209 for an individual, $4,336 for a couple per month to qualify for QMB, which is the part of the Medicare Savings Program that will pay your Part B premiums for you, and therefore give people about over $200 back per month in to spend on other needs. You can apply for this through the Choices program at 800-994-9422, and I hope that helps answer the question.
Susan, do you want to say something? Okay, let me just make a point here. What happens here, understand that there's about $1 trillion cut to the Medicaid program. That is the highest cut we have seen in the program's history. So that these various pieces, we talked about QMB and the dual eligibles here, that cut affects the lives of these folks very seriously. And in effect, you're on your own. That's not who we are as a country. That's not what we did with Medicaid. So please, I want you to understand what the nature of the cut is. 14 million people will lose their health insurance with this $1 trillion cut to Medicaid. And in Connecticut, we are talking about almost 187,000 people. In my district, that's over 37,000 are going to lose Husky Medicaid coverage. So let me leave it there. And Susan, I didn't hear anything. Did you want to add anything?
Oh, sorry, Congresswoman. No, this is not our area, so I would leave that to the experts.
Okay. Thank you, Susan. Thank you. Go ahead.
And Congresswoman, I want to. This is Judy Stein. I just want to add to your remarks, and that is that the state of Connecticut will not be able to fill the loss of that much money to the Medicaid program. So at some point, what I've said with regard to no asset test for the Medicare Savings Program, for example, and the generous income levels to our state Medicare Savings Program, both of those things are above and beyond what the federal government and other states have and the federal government requires. So we don't know at this time what the state will be able to maintain if the full Medicaid cuts remain in place.
Yeah, that's a very, very important point, because they're transferring all of this to the states, and the states are not going to be able to do it. Thank you. Mm-hmm. Next question.
Thank you so much. Let's go to our first live caller. We have William on the line. William is calling from North Haven. William, what's your question? William from North Haven, you are live. What's your question? Well, let me ask William's question for him. William is a 74-year-old vet. He's in an assistance building, and he's concerned about what will happen to us if the hikes keep happening and he can't afford medical care.
Well, William, let me just say this to you. That is really the nature of the crisis that we are in. If these cuts are moved forward, whether we're talking about Medicaid, the Affordable Care Act, veterans health care, etc., all of these health-related advances that we have made over the year to make sure that people are covered, that have health insurance. No one decides to get sick, but people get sick. And so that we wanted to, and through the Affordable Care Act, we wanted to make sure as many people as possible were covered. And that's what we did. That's what we did. And so if you're then going to begin to decimate these programs, make the cuts, and say, okay, state of Connecticut, state of Rhode Island, state of Mississippi, you pick it up. It is not going to happen, so that people will lose health care coverage. And what does that lead to? The consequences that leads to is that people can't get the treatment they need when they need it. And quite frankly, I'll be very blunt about this. This leads to people dying and not getting the kinds of treatment they need in order to be able to deal with the diseases that befall them or their families. And I'm not exaggerating that. This is not. We're talking about roads and bridges and helicopters and all these other things. We're talking about people's lives are at stake in this healthcare crisis. And that's what we're trying to do. Let's get to the table. Republicans should sit down and talk together with us and to come to a compromise and moving forward.
Thank you, Congresswoman. I'd like to quickly remind everyone on the line that you can ask a question live by pressing *3. And I encourage everyone to sign up for Congresswoman DeLauro's e-newsletter. You can do that by pressing *6. Our next question comes from Linda in Wallingford. Linda, you are on live. What's your question?
I would like to say before sentences pass, yes, I would like to say...
Linda, are you there?
Linda?
Yes, I am.
Hi.
Yes.
Linda, what's your question?
I'm sorry, *6. I was signing up for the newsletter. I'm sorry.
Well, thank you for doing that.
Congresswoman DeLauro, I think you're the best. Thank you so much for how much you love all of your constituents. I so appreciate your dedication.
Oh, my God. Thank you so much, Linda. I really appreciate that. You made my evening. Thank you.
Good. I'll hang up now. How do I hang up? You can hang up for me,
Thank you, Linda.
I guess. Thank you.
Let's go to another live caller. We have Brendan on the line. Brendan is in Stratford. Brendan, what's your question? Brendan?
Yes, can you hear me?
There, Brendan?
Yes, we
sir.
can hear you, Brendan. Thanks for being on.
Well, thank you for taking my call. As a federal employee and a disabled veteran, I'm very curious and worried about what President Trump has recently said about these potentially not paying back furloughed workers. What is Congress doing to prevent that?
Let me just say this to you. First of all, that is outrageous. That is outrageous. Let me be very clear about this. And you see, there's a lot of emotion in my voice. I have run into federal workers say, I'm in Washington. I'm here to get business done. I'm going to say this flat out. My Republican colleagues are not here. I don't know where the hell they are, but they're not here. We need to be here. But let me be clear. The law of the land says that all federal employees will receive back pay, even those who are furloughed. I'll repeat it. All federal employees will receive back pay, even those who are furloughed. There will be no agreement, if the White House tries to break this law. I will commit to you, we will fight, yes, to the death. People are not going to lose their back pay. Not when they're showing up for work. I passed Capitol Police here today, and this young woman, I said, how are you? She said, well, and she said, I'm worried. I said, we're going to fight like hell. We're not going to allow them to break the law. And that is my commitment to you, and that I should add that Trump was president when the bill guaranteeing back pay was signed into law. President Trump signed it several years ago. How does he have the temerity to walk it back and to put the fear of God into people about whether and threaten their livelihoods for the future? It's bad enough that they have to wait, but to threaten them with this is unconscionable.
Thank you, Congresswoman. We have another caller ready on the line. we have Elena. Elena is calling from Shelton. Elena, what's on your mind?
So, hi, how are you? Ms. DeLauro, thank you so much for having me on your call with you today. So as a parent, a single parent of two and working in a Head Start program, how does this affect our children? Because with them needing health care, one, to go to school, and two, provided by so many of our Head Start programs and regular schooling programs, how does that help us if they're not able to receive the care? Like, what does that do for us?
Listen, you've asked an important question. Just let me say this, because this is not the topic tonight, but I also want to tell you that Head Start is being cut. That's coming out of, another part of the budget. But they are going to, they're going to cut Head Start, which is a problem for families who rely on Head Start so that they can work, et cetera, and that their kids are in good, safe places where they are learning. But let me mention this, because I had a round table with primary care physicians in my district yesterday, I think, and I came down to Washington after that. One doctor told me that as soon as next month, first of all, people will begin to stretch their prescriptions. They're going to be skipping refills and delaying essential care. Another told me that over 40% of children in our state are on Medicaid. Losing coverage for only half of those children would be devastating for us in the long term. That is the reality. That the healthcare services that you need in order to keep your children safe, many of those services will be cut and will not be there to take care of their needs. And what I would do is Susan, when I'm going to ask you, and ask you as well, Judy, but Susan, can you talk about the premium increases for families buying coverage on access health care, and what this means if they can't afford the health care and they drop their health care, and what it means for their kids?
Sure, Congresswoman. As we know, and everyone's been talking about and messaging, if these enhanced premium tax credits are allowed to expire at the end of this year, it is going to greatly increase costs across the board for everyone that's enrolled in coverage through Access Health CT and receiving financial subsidy, which is 90% of our enrollees right now. And it also is going to make a dramatic change. The subsidies will get less rich for those below 400% of the federal poverty level, but for consumers above 400%, which is about 28,000 people right now, including families, they will lose their eligibility completely for financial help. So some of those premium increases for families are in the thousands per month if they lose that financial help. So this is very, dramatic, and also rates, unfortunately, are going up for 2026 as well. So it's really a double whammy, and, we're going to do everything we can, but obviously the fear is that if families feel they can't afford coverage, that they drop their coverage or they go uninsured. And to your point, what happens to the family and to the children to meet their health needs. So this is really an important issue.
It is a very important issue, and I thank you. I'll ask Judy to comment as well. But if people get sick and they do not have health insurance, where do they go? They go to the emergency room. And that means it is all uncompensated care. That means the costs of health care, overall for everyone go up and so forth. And I've heard from the hospitals on that issue as well. Judy, do you want to add anything to this? Okay, let's go to the next
Would you like to add to this? Okay. Congresswoman, before we go to our next caller, I'd like to ask everyone on this call our first poll question. And here it is. Where do you receive your health coverage? Press 1 if it's through your job. Press 2 if it's bought on Access Health Connecticut. Press 3 if it's through Husky Medicaid. Press 4 if it's through Medicare. Real quickly again, where do you receive your health coverage? Press 1 if it's through your job. Press 2 if it's bought on Access Health Connecticut. Press 3 if it's through Husky Medicaid. And press 4 if it's through Medicare. All right, Congresswoman, let's go to our next caller while we allow everyone to vote on that poll. Next up, we have Lucia or Lucia. You are on live. What's your question?
Hi, thank you. Thank you, Congresswoman DeLauro, for speaking to me, and thank you for everything you do. What could we do as ordinary people? I know you and your team go and fight for us. What could we do before this crisis is up or over with? I don't know.
Yeah, no, I think you've asked a very, very important question, Lucia. Let me just say there are three avenues that we have to fight back. One is that we are fighting in the courts, and the courts are our friends. We're looking at some of these cuts, and the courts are making a determination whether or not they are legal or not, trying to reverse some of this. Now, I also want to tell you that as members of the minority, as Democrats, we cannot sue, but we are working with organizations that can sue, and we are joining what they call Friends of the Court lawsuits to assist. So that's one avenue. The second avenue is we can deal with legislation. But we are, again, in the minority, so we can't win on these legislative battles, but we can certainly make the fight and let people know what's at stake. I look at the third pillar here, Lucia, which is public outcry. That is the strongest measure that we have. And that means people, yourselves and others, need to be engaged and up on your feet, complaining about this and joining with other groups who are out there fighting against these cuts. And you say to me, well, does that work or doesn't it work? It works. I'll give you one example. Several months ago, what the administration wanted to do was to say, this is to seniors, this is with regard to Social Security, that you no longer could get information about your eligibility or your benefits or any questions that you might have by placing a telephone call. That was going to stop, but what you had to do was to go to a local Social Security office. And at the same time, they were cutting the number of Social Security offices. So people may have to travel, several hours to be able to access information that they would have been able to get over the phone. Well, there was significant public outcry, and the administration backed down. They backed down. Sometimes people don't realize the strength or the power that you have to make your voices heard. And there are a number of groups out there. There are a number of groups. There are organizations. There are people. Look, on October 18th, there are going to be gatherings all over the country. Talk about fighting against these efforts. And that's what people have to do, is to join them. And I'm saying it is all, yes, peaceful. I don't believe in violence of any kind anywhere. But people have a right to speak up. And that's what folks need to be doing. And you have friends all over the country. I'll tell you, quite frankly, you can't call me, but you know where I stand. You can't call the other members of the Connecticut delegations. You know where they are. We've got to get friends and organizations in other parts of the country, in West Virginia and Alabama and other places, so that their constituents can go to their colleagues who serve in the House of Representatives and say, hey, look, where are you on this issue? Are you going to be with us? And you know what? If you can't be with us, then maybe we can't be with you. Stark is that.
Thank you, Congresswoman. I'd like to encourage everyone once again to sign up for Congresswoman DeLauro's e-newsletter. It's very informative. All you have to do is press *6 on your telephone keypad. And again, if you want to ask a question during this town hall, press *3. Our next question comes from Jesse, who is in West Haven. Jesse, you are on live. What's your question?
Thank you. My name is Jesse from West Haven. I'm a beneficiary of Representative DeLauro's efforts. My family, we've been here for a little over 38 years through her efforts. We became residents of Connecticut. We became naturalized citizens of this country. Rosa, I just want to say thank you to you for all you have done for my family in particular. My question is, I think Laura asked the same question, so I don't intend to repeat it. And Representative answered that we need to be involved in every area, make calls and talk to other people. So my question is kind of like, okay, answered already, but I just want to say thank you so much to Representative DeLauro for her great work for the African community. We may not have been too many people to visit with her on a regular basis, but I'm a direct beneficiary of her effort and love.
Oh, my God, thank you so much, Jesse. I can't tell you how much I appreciate that and how, 38 years and you're citizens, of the United States of America. And, we have similar backgrounds in this case because my dad came many, many years ago and was a naturalized citizen, and this is the greatest country in the world, and we're not going to roll back on making sure that this country are safe and that they are and they are secure. And what we also want to make sure is that that they can afford their health care and they can get access to it for themselves, and for their children. And we've got two issues here today, and Judy deals with the can answer the questions of Medicaid, Medicare, questions on what's going to happen to people, and Susan can talk about what health care is going to mean, or where it's going to go unless we do something about extending these premium subsidies, and whether in terms of we are not going to let them cut $1 trillion from Medicaid to deny people the health services that they need. So I thank you for calling, and I thank you. I thank you very, very much, and really appreciate your kind words.
Congresswoman, let's get right to our next question. We have Doreen on the line. Doreen is calling from New Haven. Doreen, what's your question?
Yes, hi. Thank you for taking my call and my question. I just wanted to ask a question about Medicare and Medicaid for nursing home residents. My dad lives in a nursing home, and he's on Medicare and Medicaid, and like you said, that the Medicaid pay a part of his Medicare Part B premium, monthly premium. And I just want to know, how will these cuts affect the nursing home residents who's on Medicare and Medicaid?
Okay, I'm just going to make one comment. We're looking at the cuts, which some nursing homes are going to shut down. But I'm going to ask Judy to answer the question here on the dual eligibles. Judy?
Hello, Judy. Are you there?
Yes, I am. I'm sorry, I was on mute. I don't want to add to your stress and worry or to your families, but the reality is that we aren't sure how this is going to really come to play in Connecticut. As I mentioned earlier, the state simply cannot and will not be able to fill all the cuts that come as a result of this law, though this state will do what it can. There will be some reductions to payments to states, tremendous reductions to states in the Medicaid budget, and as a consequence, nursing homes may well get less funding for people who rely on Medicaid, and they will look to Medicare. But the Medicare benefit, as you may know, is at best only up to 100 days, and a person has to often have been in the hospital before. It's complicated, but it is not an ongoing benefit in the way that Medicaid is. So we do need to fight to make sure that all of these programs are intact, and in particular that people who are of low income and great need enough to qualify for Medicaid, often known as Husky in this state, do not get further harmed by the cutbacks that will tremendous cutbacks that will come to Medicaid, and will affect those who are in nursing homes for sure for longer periods of time. You can call our organization at 800-262-4414, and we will try to help with individual concerns or refer you to a place where you can get assistance. Thank you.
Great. Thank you, Judy.
Thank you so much for that. Before we get to our next questions, I would like to ask everyone out there our second poll question. And here it is. The question is, if you buy your health coverage on Access Health Connecticut because of premium increases, are you going to press 1 for renew your existing coverage regardless of the increased costs? Press 2 for shop around to see if there are more affordable premiums. Press 3 for cancel your coverage because the cost is just too high now. Real quickly again, if you buy your health coverage on Access Health Connecticut because of premium increases, are you going to press 1 for renew your existing coverage regardless of the increased costs? Press 2 for shop around to see if there are more affordable premiums. Press 3 for cancel your coverage because the cost is just too high now. And I'd like to thank everyone for participating. Congresswoman, our next question is an online question, and it comes from Luke. Luke says, is there a place where one can see what the 2026 premiums will be if the tax credits are not extended?
Great question, Luke, and I'm gonna pass to Susan to answer that. She's got the definitive amount, but I can just tell you, Kaiser Family Fund put out something that said a family of 3 in Milford with 1 newborn and an annual income of $109,000 will see their premiums increase by $10,729 a year. A couple in their early 60s in Hamden with an annual income of $85,000 will see their premiums increase by $29,000, almost $30,000 a year. Susan, let me have you be the expert on this.
Thank you very much, Congresswoman. So a few things to point out here. For people who are already enrolled in insurance this year through Access Health CT, they will be getting a notice, as the Congresswoman mentioned, on October 20th, which tells them what their premium is to stay in the same plan for 2026 with the new rates, the 2026 premium rates, and also the subsidy amounts, which will be calculated under the assumption that the enhanced subsidies are expiring at the end of this year, because that is what we have to work with right now, and so how much the consumer has to pay. So people will be getting those notices on October 20th who are currently enrolled. For someone who maybe isn't enrolled and they're interested in just seeing what kind of options are available, I'll give you 2 different dates. So on November 1st, as we pointed out here, that starts the annual open enrollment period. So you can go in and go through our application, or you can go through what we call anonymous browsing. We have an anonymous browsing tool on our website, and you can put in some high-level information through the anonymous tool, or actually go in and create an application, and you can see what the options are. It's going to depend on the age of the people enrolling, how many people are in the household, and the county where they live. Those are the factors that go into rating premium, and also the plan that they want to pick. We have a whole range of plans. We have 22 plans available for 2026 at all different tiers, bronze, silver, and gold as well. So it's going to range depending on the plan, depending on the benefits of the plan. Also, through that anonymous browsing tool, starting the last week of October, the 2026 rates, right now it has the 2025 information in it. Starting in 2026, you can go in and find out, entering that high-level information for that last week of October, what is available to you, what kind of subsidy you might be eligible for, and how that converts, to a plan, the different types of plans, depending on who in your household is looking for coverage. So there are a lot of tools available for people to look at to find Connecticut-specific information. Thank you.
And also, my office, my team is going to be, gathering information and trying to help to answer these questions as well. I just want to clarify, Susan, what goes out on October 20th, the premium increase will be the amount that you will owe that is without the premium subsidy.
Without the enhanced subsidies that are expiring, yeah. I just want to, and this, can be very confusing for everyone. The original ACA subsidies are still in place regardless of what happens regarding the enhanced subsidies. The enhanced subsidies is a different structure, a richer structure for consumers, and also allowing those over 400% of the federal poverty level to be eligible. That's been in place since 2021, thanks to Congress, from the American Rescue Plan Act and the Inflation Reduction Act. But the original ACA subsidies will still be available if the enhanced subsidies don't get extended. But obviously, the enhanced subsidies have made a dramatic difference in affordability for consumers. We now have 24 million people enrolled across the country. Here at Access Health, we have our highest enrollment ever. We have close to 160,000 people enrolled right now. I think it's 157,000 as of today, and that's just a huge increase than we had before the enhanced subsidies were in place. So that has made a dramatic difference.
And when you use the word enhanced, I just want people to understand that. That means additional financial support for you to be able
Correct.
to afford your insurance. That is what is being removed, and that expires at the end of this year. And Speaker Johnson has said, in essence, let's kick this conversation down the road. No, it's now, because of the dates that are involved, where people are going to have to make a December 15th payment on a premium so that they can have health care on January 1st, 2026.
And it also impacts, just to add, it also impacts the rates that the insurance companies will be charging for 2026. They had to look at whether there were enhanced subsidies in place or not in place. So right now, the rates are based on enhanced subsidies not being in place, and if they do get extended, then there'll just be a little bit of work to be done to update that as well, which actually, makes a more positive difference.
Okay. Thank you. There is look, and if people, if healthy people drop their coverage by, 2027, the rates would also skyrocket. So there we go. But let's take another question here.
Thank you, Congresswoman. Next up, we have had several people ask about this issue. They've asked about whether undocumented immigrants can get Medicaid or ACA subsidies. Can you talk about that, Congresswoman?
I am happy to talk about that, and I really want to say thank you. Thank you to people asking these questions. Let me be clear. What is being perpetrated by Speaker Johnson and my Republican colleagues and the President of the United States is that we are, what the Democrats are about, is that we are asking for what we're doing here to be able to give health care coverage to undocumented immigrants. It's a lie. It's a lie. Undocumented immigrants are not eligible for federally funded health care coverage. That is Medicare, Medicaid, the Affordable Care Act, the CHIP program. They are not eligible. And I can, if anybody wants, they can let us know. I can send you the statute and a copy of it so you can read it yourself, so you don't have to take my word for it. I would also say one other thing, that what Ronald Reagan in 1986 said to our hospitals nationwide, that if you have someone who is in an accident, who has emergency treatment that they need, if they're in a car accident, if they're on the ground, if they're bleeding out, that you can treat that person. And what we will do is to reimburse that cost. Ronald Reagan in 1986 said this. And the Republican proposal going forward includes this as well. So they are lying about what it is that Democrats are trying to do. And yes, and you should also know that can use Medicaid for that reimbursement, but it is only 1% of the Medicaid costs. But I want to tell you that the Republicans, this emergency piece is in their continuing resolution. I'm going to mention it one more time for people who might just joined us. Undocumented immigrants are not eligible for federally funded health care coverage. Medicare, Medicaid, the Affordable Care Act, the CHIP program, and that is, and there's a statute to prove it. So there we go.
Thank you. Let's get right to another live caller, Congresswoman. We have Michael on the line. Michael's calling from Hamden. Michael, you're on with the Congresswoman. What's your question?
Hi. Good evening, Congresswoman DeLauro. And I want to say thank you for all your service to the district. I've actually had the opportunity to get to know you over the years, and you've even been to my family's home. So appreciate that, all that you've done. My question, well, first of all, I'm 64 years old. My insurance is Medicare. And I know that we're looking at $1 trillion in cuts to Medicaid, but possibly a pullback of about $500 billion of cuts into Medicare. So my question is, no matter what type of agreement that you are able to reach with the Republican Party, what are you, and I know that you're an appropriator as well, what are you, the Democratic leadership and the Democrat Party at large, how do we hold President Trump and the Republicans to any deal that is agreed upon, as he is well known to go back on agreements, impound the appropriations that come out, or do pocket rescissions? So that is one of my concerns, is that no matter what agreement that is made, how do we, as your constituents, feel some comfort that it's going to be kept? And final part, which is kind of a little side piece to this, is with Social Security. I've heard recently that the Republican Party and the president is now saying that inflation is at zero. This is around the time of year we hear about COLA, and because there is no data coming from the BLS, the Bureau of Labor Statistics, right now, I'm wondering if that's also a way to also hurt seniors in that manner by just claiming, well, you know, there's no inflation, so there's no need for a COLA. And that is my question.
No, that's very, very good. I'm going to ask, before I get to the issue of, you know, them stealing taxpayer funds and just doing that willy-nilly, let me ask Judy to briefly explain this $500 billion that over 10 years will be cuts to Medicare.
Yes, we don't know where it will be coming from, but it has to come from someplace. And there is a law that says if Medicare begins to cost more than a certain amount of money, that Congress must make cuts to the program. And there's so much involved with this, but I will say that one thing that I think it's very important for people to know is that the private Medicare Advantage program, which is getting Medicare, when you get Medicare through private insurance companies, United Health, Aetna, and Humana are some of the biggest players, costs us billions of dollars more than if people were in traditional Medicare. And this is something that if we really care about what all of Medicare and the other healthcare programs are costing us, really needs to be looked at. But instead, the Medicare Advantage program has been favored and is now more than half of the home of more than half of the Medicare population. This is a place where we really could save money, and we could add dental, hearing, and vision benefits to Medicare for all in the traditional program if we weren't overpaying the private insurance companies to provide Medicare through the private profit system. So the $500 billion, we don't know where it's going to come from, but it could be mandated to be cut from benefits. And there are ways to save money to Medicare, particularly by looking carefully at the overpayments to the Medicare Advantage insurance companies.
Let me just add to that is we have something, a law called Pay As You Go. And when they passed their big, beautiful bill and provided $4.5 trillion in tax cuts for the wealthiest individuals and the biggest corporations, what that did was to really add, it added to the deficit. And any time you add to the deficit, you have to find a place to get this money from. Now, they will not take the money from Social Security, but they will take the money. And by the way, they could have waived this, but they didn't agree to do that. The money would come from Medicare, and over 10 years, that the dollar amount is $536 billion that will be taken from Medicare. So I think you should understand that piece. Now I'm trying to remember there were two other things that you were talking about. Talk about this, which is a very big issue for me as somebody who sits on the Appropriations Committee. What we did, you say, well, what have you guys done? You didn't like their bill. What have you done? Okay? Well, this is what we did. That's myself in the House as a ranking member on Appropriations, and my colleague Patty Murray from Washington State in the Senate. We introduced a bill that would keep the government open through October 31st. We would avert the shutdown, and we would allow negotiations to continue. And what we said in our bill was what we would do is to address the health care crisis that the Republicans and President Trump have created. What we would do is to reverse the Republicans' devastating Medicaid cuts and the attacks on the Affordable Care Act and prevent the Americans' health care premiums from skyrocketing. And then the third piece, which was very important, it would provide for a mechanism to address what the president is doing with illegally stealing the funds that have been appropriated by Democrats and Republicans in the House and the Senate, which is again against the law. This is their partisan cuts, so it would get at your point of the pocket rescissions would no longer allow them to do it. Those were the stipulations that we had in our bill. And now in the House they voted against it, and I think they have voted against it in the Senate. 3 times already, and they're going to continue to bring it up, but the Senate is holding fast on that issue, so that they not allow them to continue to steal the funds that the Congress has appropriated to deal with the services that we need to provide to the American people. I don't know if either Judy or Susan, I don't know. I don't have an answer for you on what they may be doing with the COLA for Social Security yet. And I can get you that information. I don't want to say something that I don't have a real answer for. So I apologize, but we can try to get that information for you. Thank you.
Congresswoman, unfortunately, we're just about out of time, but I want to let everyone know that's on this call, if we were not able to get to your question this evening, you can contact us through our website, deloro.house.gov, or leave a voicemail on this line after the event. We'll continue to host more of these events in the future to keep you informed on what we're working on and other important updates. With that, I'll turn it over to the Congresswoman one more time for a closing remark.
Okay, thank you so much. We've seen a number of people have asked about how can they get their questions answered, either from Judy Stein, the Center for Medicare Advocacy, and from Access Connecticut Health through Susan Ridge-By. And so, if either of you would like to, give a number or a way they can be in touch, I'll ask you to do that, and then we'll also try to get the information out. So, Judy?
Yes, I'd be delighted to do that. The Center for Medicare Advocacy helps all Connecticut residents throughout the state at no cost, thank goodness, to various grants and contracts from the state and other places we hope that won't be cut. You can reach us at 860-456-7790 or 800-262-4414. Our phone is answered from 9 a.m. to 5 p.m. by a real live human being, and if we can't get to your question right away, which we usually do, you will be called back within 24 hours. We also have an extensive website with a lot of information, and you can reach that website at www.medicareadvocacy.org. That's medicareadvocacy.org or 860-456-7790. Thank you for the opportunity.
Susan?
Thank you for the opportunity as well. We too have a call center that is available to help people, and we also have assistance in over 100 languages. So the number for the call center is 1-855-805-4325. We also have a TTY line at 855-789-2428 for customers who are deaf or hearing impaired, or they can call the main number and use a relay operator. We also have a very robust website, which is our enrollment website, and it has a ton of information on there for people, and 2 spots on there. So the website is accesshealthct.com, and then I would say there are 2 good spots on there looking for help, and all help is free. There is, if you go to the website and you can click on a link for that says Get Help, for a list of places to get free in-person help. And if you are interested in working with a broker who can help you pick what plan is best for you, and that is free as well, you can go on to our website, accesshealthct.com, and click Get Help, and then click Find a Certified Broker. We have over 800 certified brokers located all over the state, and if you go to that Find a Certified Broker tool, you can look up in your area and get a number of names for someone who can help you. And we also, with all of these federal changes, people are, confused and want more information, and if you go to our website, There is also a link to a federal changes page that we put up that has all of the information on all of the changes on that one page. So thank you.
That's great. Thank you both very, very much. I love you guys. You're great, and thank you for answering the questions. Now, let me just say, if you all have any questions or concerns that were not addressed tonight, please reach out to my district office staff, and you can reach them at 203-562-3718. 203-562-3718. Just my final comment to you is that I want you to know, and I want to hear from you, because I'm going to fight back. I'm going to fight back on President Trump's attacks on health care in the United States. I'm going to keep them from dismantling public health in the United States. I'm going to do that at every step. But again, I want to urge you to make your voices heard. Public opposition and outrage matters. They have already been forced to step back on several fronts. Let me just tell you something about the United States Congress. They respond to external pressure. All of you out there are the external pressure. So please, speak up. Now is the moment to do it. Good night to you. I hope you have a very, very pleasant rest of your evening, and I hope to hear from each of you soon. God bless. Take care.
Thank you so much.